President Trump is holding an event at the White House today to push the Senate to pass his cornerstone budget bill ahead of his July 4th deadline. He'll highlight proposals for additional border security funding and eliminating taxes on tips and Social Security. It will also feature people the administration says would benefit from the bill. Kansas Republican Senator Roger Marshall, though, addressed some of his concerns with the legislation yesterday. Listen.
I wish we could have cut more spending. I think we cut about 1.6, 1.7 trillion. My biggest concern is this $37 trillion national debt we had. But look, I think the benefits outweigh some of the challenges there. Again, it'll prevent the largest tax increase in American history. It's going to fund the border. It's going to make our military secure.
Meanwhile, dozens of celebrities have signed an open letter to Congress protesting the proposed cuts to Medicaid and the Supplemental Nutrition Assistance Program, also known as SNAP. Scarlett Johansson, Rosario Dawson, Liv Schreiber and Sheryl Crow are just some of the people supporting this message and signing on. The letter reads in part, quote, "This is unacceptable and wrong. It is not how people in this country treat each other when facing hard times. We call on Congress to reject cuts to these vital programs that help millions put food on their tables and provide access to health care." Phil Galewitz is a senior correspondent for KFF Health News, and he has more on this for us, joining us from Washington. Good morning to you, Phil. Who knows if, celebrities signing a letter will make a difference, but let's start with Medicaid. For viewers who rely on this, how might their lives change if the bill passes as is?
Sure. The bills being debated in Congress right now would affect people who live in the 40 states and Washington, D.C., which expanded Medicaid under Obamacare. Most of these states expanded over the last 10 years, and there would be major funding cuts to Medicaid to help pay for the bill. There are three main areas. One, it would require states to implement a work requirement that people would have to report in at least every 6 months about their work status, and if they don't work, what exemptions they may have, such as being disabled, being a caregiver, and they would have to report to the state every month, and there's a fear that some of these people would not report or would fall off. Medicaid would also cut funding to states by billions of dollars by cutting something called provider taxes, and that money would leave a lot less money in the system to help enrollees get coverage. There's another cut also that would, a number of states have expanded coverage to undocumented citizens over the years, and this bill would basically penalize states that do that by taking away their Medicaid funds. So it would take over $700 billion in Medicaid away, and states are not sure how they would fill in that gap at all without having to cut services and cut benefits for enrollees.
And there's a lot there. Republicans say they're trying to stamp out abuse and waste, but the bill that you mentioned, the tax portion, it would cut the tax states impose on Medicaid providers from 6% down to 3%. And critics claim that will create real challenges for rural hospitals specifically. Explain why that is.
Right. Rural hospitals already operate on very thin margins, barely get by, and a lot of states have try to help rural hospitals and other hospitals buy these provider taxes, which some people call a gimmick because of the way it operates. Hospitals sort of pay a tax into the state, which sends up the money to the federal government. The federal government then matches the money, sends it right back to the state, which sends it back to the hospitals with more funding. Republicans call this a gimmick. States and healthcare providers call this a way that they've been able to survive and expand services. I've talked to hospitals that say this extra money makes the difference from them staying open and providing new services and updating technology. And without it, they're not sure how they would make it up. So there's really no way for states to easily make up that funding.
And Phil, I want to ask you about SNAP just before our time runs out, because there are cuts to that food assistance program. Remind us who relies on that.
Right. Tens of millions of low-income people need food assistance, and this would add, again, more work requirements for people on SNAP that don't exist now, and it would cut funding to states. It's a state and federal shared program, and it would cut a lot of money to states with the expectation that states would somehow make up the money, but that's doubtful that states would do that, and people would go without because, again, fewer people would benefit because some people might fall off with these new work requirements that don't exist yet on SNAP, and it's unclear how people would be able to get the food they need without this funding.
Sobering stuff. Phil Galewitz, thanks for joining us.